I always wanted to be a doctor from when I was in fourth grade. So it was a dream of mine. I read a book about Elizabeth Blackwell, the first woman doctor, and I wanted to do what she did. And no one else in my family is a doctor, so I don't think I really understood what doctors do, but I had a vague idea that they help people. So I had planned on going into internal medicine. And then when I hit the wards, kind of really started seeing patients as a third year medical student, I was very surprised. Like, is this what it is? And one of my first rotations was in primary care. It was in outpatient internal medicine, outpatient sort of primary care internal medicine practice. I totally believe the patient can influence the interaction. And that's why I did put the patient sort of patient recommendations onto pages that are Black, because I know that a lot of people don't have a lot of time to read, especially if you're really under stress, right? So it's like sort of, you can do this, you can do this. So I know this to be true because I actually know from the doctor side, because when patients come to me and they're smiling, right? It automatically puts me in a better mood, automatically. And not to have toxic positivity. I agree with you that social media, it's all like, oh, look at me, they're smiling. And I recently heard about emotion research. Sadness was actually the most valued emotion. I didn't know this, but maybe 2 centuries ago, sadness was the valued emotion. And people went to workshops on how to be sad. Because actually, when you're really, research has also shown that sadness actually is more of a motivator than happiness, which makes sense, right? Think about when you're super happy, you're just like, oh, I'm so happy. And you don't actually get anything done because you're just like floating and you're not, your mind is just, woo, right? But sadness, think you're like, and you don't, not depression, because depression's a medical condition. But if you're sad and you're kind of, it's like, oh, like, and you're kind of still in a way, and that's when we can be effective, right? So when I heard that, I thought that was fascinating. But so caveat with that, when the patient comes in smiling, it's great when they're smiling. But if they come in and they're angry and they tell me they're angry, that's helpful too. Because they'll say, why are you angry? And they'll say, well, you're running late. So then I'll say, I apologize, and I'll say, what can I do to help this next time? And then they'll say, well, I don't want to be waiting this long, or like they'll tell me they don't mind that they were waiting, but they have X, Y, and Z going on, or actually they really couldn't come to an afternoon appointment, but they did anyway. And look what I've done to them. So they'll say, okay, next time I will try to see you in the morning. So it's important information. That's what the emotional data is important. So the patient, by telling me why they're feeling what they're feeling, it's really important. I think it's about creating that safe space. So that's important, I think, for the patient to just try to be upfront with your doctor. And I know it's hard if the doctor seems very detached, but try. And so you don't even have to start, the patient doesn't have to start with emotions. It can just start with, I know that a lot of doctors say they hate it when a patient brings in a list, but I actually don't mind anymore, because then I can take the list from them and I can say, look, we don't have time for this whole list. I think this one's most important and we'll address this. Is that okay with you? And I can just turn it on them. I'm not good at that. I'm working on that. I actually tend to go through the whole list and I'll run behind and then I'll be upset. But that's my fault, actually. I shouldn't blame the patient for that. It's my choice to go through that whole list. And so that's what I mean by this awareness. Be aware. I don't want to come across as a bad doctor, so I'm going to go through this whole list. And meanwhile, I'm going to run late because the system, right, has created this thing. So I also just need to recognize I'm human, I'm finite, and say, this is a really long list. I'm glad you wrote it out for me. I recognize all of this is important. Let's go over 1, maybe 2 things that are so important. So that's another way. Know your agenda. As the patient, you have to know the agenda, your own agenda, not the doctor's. If what you care about is the doctor's, that's okay. Just say, doctor, you take over. I don't even know where to start, and then the doctor can do their thing. Some of my patients are like that. They don't have a problem. They're coming in because they're like, I want to see a skin doctor. That's okay, right? You don't have to have agenda. If you don't, great. But if you do, lay it out there. If you have emotions and you are the type of person who'd feel better, that the doctor would lay them out there. If you're someone who doesn't want to talk about emotions at all, and say they encounter me who's like, what are you feeling? You can just say, I don't want to talk about that, or I'm not ready. And I say, okay. And, that's okay too, right? Every patient's different, every doctor's different. And so that's what I mean by awareness. There's no one size fits all model at all. So the patient can absolutely change the interaction, body language. One major thing I talk about, it's a little trick. It's very simple. It's eye contact. I've gotten that feedback I was in a medical education fellowship for a year here at my institution. And I sort of piloted some of these ideas with, it was a variety of doctors, MDs from lots of different specialties and radiology, cardiology, etc. And they did say, they're like, they don't read books for one thing. Like, we don't read books. And some of them do, but we're like, we don't have time to read books. We don't even have time to read our medical journals, So, but I still have hope, because I think this isn't actually more work. We're doing it anyway. We're in the room with the patient anyway. And really all it takes, like you just mentioned, it's self-awareness. I'm a person and this is a person, and we're two different people. And I think really that's where it starts. And that is what makes us human, right? It's why, like, why do I think I'm me, right? I mean, it's philosophical, but we all believe that life has meaning, right? Otherwise, that's why we keep waking up every morning. And we all value, true depression and certain diseases, it's hard, right? Because I think you start to sort of wonder more about those things. But I think in a healthy space, we do value life. But it does end. And so not that we should, overly focus on the fact that life ends, but I think that is part of being aware that life still has meaning. We must think so, because otherwise, why do we keep going every single day? Life absolutely still has meaning, even though death will be there. And I think I don't mean to be kind of like all like death and destruction, but I realized more, and I think reading some of the books that came out of the Holocaust has helped me, because what more horrible, there have been other things that sort of that are on that level, but it's absolutely horrible, right? And I read these stories, these true stories. Sometimes I'm like, how do you keep getting up in the morning? Everything has been ripped away from you. Everything, your family, your clothing, your hair, there's no beauty in yourself, right? You look horrible because you're starving. They didn't even have bathrooms. They didn't have showers. They're like lying on wood, bare wood. They're freezing, right? And as a doctor, I'm like, how do you survive? I'm like, it's cold. I need my jacket. They're like wearing rags, and it's, negative. So human beings are resilient. We're like amazingly resilient on a health level, right? If our body is deciding to survive, we survive. But I agree. I think it's mental. And what kept people going? I'm sure it was different for a lot of people, but it's in Man's Search for Meaning. For him, it was his work. He had this dream. He had almost published a book right before and he had the opportunity to come to the US, but he didn't want to, he chose to not leave his family. And so he had his manuscript kind of rolled up in his pocket when he first entered the concentration camp. And he was thinking, he sort of asked around, he's like, but I need to keep this manuscript. I can get rid of the clothes, but I need it. And they're like, too bad. You're not keeping that manuscript. And so he relates during the horrible time when he's in the concentration camp. He kept thinking of his manuscript and thinking, oh, I'm going to rewrite this passage, or this passage is this. And that helped keep him going. So for him, it was work, this life's work, this idea, this idealistic, this a little bit outside himself, but it was still him. And I think it was like, even if it's in his head, that's enough. That's life for him, right? I started with eye color. I did. Just note eye color. And I know in Asia, and in Africa, maybe it's less interesting because it's brown. But brown eyes are not all the same shade. So just think of it, what brown is it? Is it lighter? Is it darker? I think you'll be surprised because, you think, because I am Korean and I grew up partially in Korea. And so you think, oh, like everyone's eyes are the same, but they're not. So if you need to like use eyelashes, use the eyelashes, right? Everyone's eyelashes are actually quite different. And India, I would say, some of my Indian friends have the most beautiful eyelashes ever. So if the brown doesn't work for you because you find it boring, then you could say, okay, how long are these person's eyelashes? To just be like, are they longer than mine or not? Just something simple, but something like that works for you. Something I think close to the eye that makes you look at the eye. I would say just start there if you're remedial like me. If you already make eye contact, or you're already a very charismatic doctor and you've already been getting feedback from your patients like, doctor, I love you, like, doctor, you're the best. And the patients mean it. And you still want to improve with how you connect to patients. I would say maybe think about a difficult interaction that you had with a recent patient, and just become aware, why was it difficult? Was it something that either you did or the patient did, and then work from that. So say, I don't know, say the patient says that, oh, you didn't listen to me, or maybe I could take something recently. We went to an appointment for my son, and then she had given me a handout. And she didn't remember when I talked to her on the phone, and I said, I just need your help. I need to know more. And she was like, well, I'll email you a handout then. And I just said, well, you gave it to me already. So say that doctor is thinking, oh, I'm very charismatic. And then they hear from me on the phone, well, no, you already gave me that handout. You could take something like that, like, oh, I didn't remember I gave the patient to me, it wasn't a big deal. But say you're like trying to improve, and you that's the type of feedback I mean. Just, it can be small, it can be something that doesn't necessarily bother you. But say you're like, well, I want to better connect. I think that is something to remember the things that you gave the patient, and to remember the things that you said, right, or didn't say. Because I could tell from the way the conversation went that she clearly didn't remember me, and I'm okay with that. I think I feel most patients are okay with that. They recognize that a doctor, I mean, imagine if it's 60 patients in a day, you cannot remember until maybe you've seen them over and over again, right? But I think that what I've learned, and maybe other charismatic doctors do better, is to start from that first visit, to start to think, okay, I'm going to try to remember this patient. I'm going to assume this patient is going to stick with me, and I'm going to try to remember them. So now with electronic medical record, it is a little easier. I mean, it's such a time sink, but you can write notes to yourself, right? And just check before you call them back. If you literally have no idea who they are, check what you gave them, because now there's an after visit summary in the US of what you gave them. Or make it standard so you always know. For example, make it standard that you give them a handout and say, well, the handout I gave you. And then that can make the patient feel like, oh yeah, like she remembers that she gave me something, right? And then the patient might say, I didn't read it, but then that's useful feedback too. Like, well, why didn't you read it? Not in my language, or it was too small, or, whatever. And then you can change the handout, right? So I think that's what I mean. So if not eye color or eyelashes, and you think you're great, then just think back to some most recent feedback. And I think it's most helpful if it kind of did hurt you. And then just think back, well, how could I be better about that with the next patient? In some ways, that's an impossible question to answer, because I think every doctor is different and every patient is different. And I will say that even now, when I'm actively working on this kind of, building a connection with every one of my own patients, I can immediately tell that some patients do not want to connect. They actually are detached. I come in, I smile at them, I make eye contact, and I can tell they're just like, oh, yes, hi, right? But I think that's information too. They don't want to connect to me. And sometimes in the course of that first visit, I'll be able to break it down, and they're like anxious about a medical problem or not. They're anxious about their husband or something, and then we connect, right? Because they feel better. They're like, oh yeah, even just that one, like you were mentioning, acknowledgement. They acknowledge to themselves. Maybe they didn't even realize, my husband's having surgery in a week. I'm worried about it. It doesn't take much time. It's like 3 seconds. She told me, and I'm like, oh, okay, it's not about me, right? I think an important thing to do for me, one thing that's helped me is to just go from a baseline assumption, and this becomes habit too. It's not about me. I have a little bit of that in my book about role playing. And there's an excellent course. Maybe you guys, I haven't had a chance yet to check it out, but it's called Course in Clinical Competence. And apparently it's online and it's free. So accessible to anyone around the world. And it's just simulations, but the doctor has a story and the patient has a story, interestingly. So when you do the simulation, the doctor, you're supposed to act out. You come in with that story and the patient's supposed to act out. You come in with that, right? And it's going to be a different interaction with every, right? It's the same scenario, but you're going to act it out differently. It's fascinating. As a doctor, and even as a patient, I think it's true on the patient side, you have a choice of how much light you're bringing into the room. And I think that's very important from the doctor side because you are the authority figure and you're the one who's not sick, hopefully, right? You're the one who's healthy. And so when you come into the room, and I realized this, but that's partly for me, I didn't have it in that language, but making the eye contact, smiling, and smiling puts everyone in a good mood, better mood. I shouldn't say good mood, a better mood automatically. That's psychology too. And then if the patient smiles back, to me, that is a way to establish connection. But say the patient doesn't smile back, and that does happen, I would say even maybe 50% of the time still for new patients, because I really do think there's a lot of distrust in the US, unfortunately, of the system, not necessarily of the doctor, but of the system, or, just patients are tired, and COVID, everyone's tired, So from yesterday, I thought that too, yes, it's about light. So I think if you just come in and you bring light and say you realize, oh, my light is too bright right now for this patient, you can dim it down, right? Or if it's like, oh, I think maybe it's not enough light for this patient. Because if you think about it as light too, light dispels darkness. It displays confusion, it displays anxiety, it displaces fear, all of that. So I think that's another way of thinking it. I think we can at least partially bring some of that. And you can think of it as light or energy or these little habits. But I think that is a place to start. I think really be aware. I think be aware, and that's really all. I think it helps to be aware of how I'm coming across to my kids. It helps to be aware of how I'm coming across to my husband, my work colleagues. We really do be aware that you have more power than you might think.